Stroke is the leading cause of morbidity, mortality, and disability in the United States. In fact, about 140,000 people in the United States alone will suffer from stroke. And even more astounding is that the cost of disability after a stroke is about $5,000 a month on average. These are just some statistics. It varies, but it's very important to talk about carotid disease and why you should care. I often see patients in my office, either referrals by primary care physician or cardiologist, who come with outside imaging, screening ultrasounds, and they're found to have carotid disease. Usually, some sort of symptoms or even just having certain comorbidities, such as long-standing hypertension, diabetes, smoking history, will prompt a workup where you're found to have carotid disease. Usually at the bifurcation or split point of the carotid artery, we have two carotid arteries that run in the front of the neck. There can be plaque buildup, as these bifurcation points or split points with the arteries is where there's shear stress and an increased risk for developing plaque. Buildup becomes enough to cause a significant amount of stenosis or blockage. There is a risk that that plaque can then go up to the brain and cause a stroke. But not every blockage needs to be treated with surgery. Every patient with carotid artery disease should be on best medical therapy. This is a combination of aspirin, a high-dose statin medication, lifestyle modifications, smoking cessation, first and foremost. In addition, those patients who are symptomatic, having mini stroke or have had a recent history of a stroke, I do recommend a carotid intervention. In 2025, this is not only a carotid endarterectomy. In certain select patients with the right anatomy, a carotid stent can also be considered. Carotid stenting has been in the armamentarium of treatment plans for a very long time, and as vascular surgeon, I also perform TCAR, which is a transcarotid stenting. There's also transfemoral stenting down through the femoral artery. In symptomatic patients, more than 70%, or asymptomatic patients, more than 70 to 80% is where I tend to recommend intervention. Data and evidence, carotid interventions is constantly evolving, but one thing most vascular specialists will agree on is that once you reach at least 80% of blockage in an asymptomatic carotid disease, you should have some intervention in the right patient profile. And then in symptomatic patients, so symptoms such as transient loss of vision, facial drooping, slurred speech, lateralizing symptoms such as focal weakness in the arm or leg, those are all risk factors for developing. Those are all symptoms of a stroke or a mini stroke and should not be taken lightly. If you've ever wondered, getting lightheaded could be a sign of carotid disease because there are blockages in the carotids that are somehow causing your brain to not get perfused, those are not typically signs and symptoms of carotid stenosis. Lightheadedness definitely prompts a workup, whether it's an MRI scan of your brain or a workup to see if there's carotid blockages. But rest assured, the body is actually very creative in getting the blood supply you need to your brain. There's two carotid arteries in the front and two vertebral arteries in the back, and a whole network of vessels right here in the brain called the Circle of Willis. And it's not just dependent on one carotid artery. But the reason to intervene on carotid blockages is to prevent stroke or decrease the risk of stroke.